While the Civil War was fought, little was known about what caused disease, how to stop it from spreading, or how to cure it. Surgical techniques ranged from the barbaric to the barely proficient. A Civil War soldier's chances of not surviving the war was slim to none. These fallen men were cared for by woefully underqualified, understaffed, and undersupplied medical corps. Working against incredible odds, however, the medical corps increased in size, improved its techniques, and gained a greater understanding of medicine and disease every year the war was fought. When the war began, the Federal Army had a total of about 98 medical officers, the Confederacy just 24. By 1865, some 13,000 Union doctors had served in the field and in the hospitals, and in the Confederacy about 4,000 medical officers and an unknown number of volunteers treated war casualties. A physician received minimal training. Most of the older doctors served as apprentices instead of formal education. Even those who had attended one of the few medical schools were poorly trained. In Europe, 4-year medical schools were common, laboratory training was widespread, and a greater understanding of disease and infection existed. The average medical student in the United States trained for 2 years or less, received practically no clinical experience, and was given virtually no laboratory instruction. Even Harvard University did not own a single stethoscope or microscope until after the war. For every man killed in battle, 2 died from disease. The U.S. Sanitary Commission was organized by civilians, run by civilians, and funded by civilians. It was a private relief agency created by the federal legislation on June 18, 1861 to support sick and wounded soldiers of the U.S. Army during the Civil War. It operated across the North, raised its own funds, and enlisted thousands of volunteers. The United States Sanitary Commission's Hospital Directory collected and recorded information concerning the location of the sick, wounded, and missing soldiers for the benefit of family and friends. The U.S. Sanitary Commission's contributing significantly to alleviating the suffering of soldiers was the forerunner for the American Red Cross. Clara Barton established an agency to obtain and distribute supplies to wounded soldiers. It was called the American Red Cross, and she was the director until her death. Her drive to create an American chapter of the Red Cross came during a trip to Europe. As Barton expanded the original concept of the Red Cross to include assisting in any great natural disaster, the service brought the United States the Good Samaritan of Nations label in the International Red Cross. This organization also allowed women to help in the Civil War as nurses. Of approximately 175,000 wounds to the extremities, mostly caused by the Mini-Ball, received among both Union and Confederate troops, about 30,000 led to amputation. Every effort was made to treat wounded men within 48 hours. Most primary care was administered at field hospitals located far behind the front lines. Most amputees did not experience the surgery without an anesthetic. Generous doses of chloroform were administered beforehand. The screams heard were usually from soldiers who were just told that they would lose a limb, or those who had witnessed other soldiers losing their limbs. While most surgeons were aware of the relationship between cleanliness and low infection rates, they did not know how to sterilize their equipment. And also, due to a frequent shortage of water, surgeons often went days without washing their hands or instruments, thereby passing germs from one patient to another as he treated them and causing high risk of infection. Despite these fearful odds, nearly 75% of the amputees survived. About half of these deaths were from diseases during the Civil War, and they were intestinal disorders and mainly typhoid fever, diarrhea, and dysentery. The remainder died from pneumonia and tuberculosis. Both the North and the South struggled to improve the level of medical care given to their men.